Hello, Wellness Tribe, and welcome to a brief overview of technique in the abdominal plank. While many individuals perform planks as a part of their exercise routine, not everyone has been coached through on how to actually perform this movement. One of the ways we can look at effective plank technique is by looking to the research, which we may find here in a 2020 article published to the International Journal of Environmental Research and Public Health. While somewhat narrow in scope, we can find here that the simple difference of a, quote, hollowing maneuver while performing the plank resulted in significantly increased muscle activation over the traditional technique. In this study, the maneuver is described as retracting the navel while contracting the abdominal muscles, holding for 10 seconds, and maintaining the breath. In other settings, this may be cued by a personal trainer as pulling your navel back towards your spine, effectively pulling in your stomach without sucking in air, but rather through contraction of the muscles present. Furthermore, we can see the difference between the standard and hollowing groups in this table, where increased levels of muscle activity can be seen in all of the tested muscles. I'd like to draw your attention to the final two measures taken, both the left and right internal obliques. We can see a very substantial difference in muscle activation over the standard group, which is further exemplified in the figure here. Now, it is important to note that this is simply one study involving one example of a technical change that can be applied to the plank. There are a myriad of variations and technical cues that can be applied to the exercise. This is just meant to convey how substantial relatively small changes can be. For the plank being demonstrated here, the cueing involves keeping a neutral head, having shoulders stacked above the elbows, retraction of the navel, glutes locked, and toes flexed. We can visually assess the difference if the glutes are relaxed as the hips sag downward, losing the straight line that we could see. Inversely, if the hips are then excessively elevated, we can see that they are unable to contract and more force is put into the shoulders while relieving tension on the abdominals. Shown again from a push-up position, we can see how much spinal hyperextension may occur as the hips sag. And again, this is mirrored by the increased deltoid activation as the hips raise above the neutral alignment. Hand placement can be varied as well. Here we can see a few different positions. Often it may be recommended to switch to a neutral forearm alignment to avoid over-patterning the same internal rotation we experience the majority of our day. However, finding a position that is comfortable is best. Once you find a comfortable position to properly contract your abdominal muscles and glutes, then potentially try experimenting with grip variation and such. This video is not meant to be an end-all be-all on how you should be performing your planks, but rather an invitation to be more critical of yourself and how you perform these movements. Are you active in your planks or more so passive, just barely hovering your hips off the ground? Take an internal assessment of your exercise practice and potentially look to incorporate some of the research discussed here. As a reminder, I am neither your doctor nor your physical trainer, so take this all lightly with how it relates to you as an individual. If you have a trainer, speak to him or her about it. I am not recommending any of this per se. However, I am calling attention to influencing factors of a movement you may already be performing. Be safe, understand and learn to differentiate between pain and discomfort, and be healthy. Thanks for stopping in today, Tribe community.